Hello everybody, I am Dr. Chinnababu Sunkavalli. I am a Robotic Surgical Oncologist at Apollo Hospitals, Hyderabad. Today we will be discussing on what are the symptoms of gastrointestinal cancers. So if you look at the incidence of gastrointestinal cancers, it is dramatically increasing next only to the most common cancers like head and neck cancers and the other cancers in female like breast and cervical cancer. We look at the GI cancers being on an increasing trend. So if you look at these common symptoms, I think one must give importance to understand any change in their bowel and their bladder habits. So if there is any increased incidence of diarrhea, or if there is any bleeding in the stool, if there is any mucus or some discharge in the stool, you should immediately report your doctor. So any change or alteration in your bowel habits must not be ignored. So there could be a blood in the stool, there could be mucus in the stool, there could be increased frequency of the stool, there could be constipation, or sometimes for upper GI like for stomach cancer and esophageal cancer, there could be symptoms of loss of appetite, loss of weight, and not feeling like having food. Difficulty in swallowing could be a symptom for esophageal cancer. So these are the most common presentations for the upper GI cancer and even for lower GI cancer, wherein people would have a change and alteration in their bowel habits. How does chemotherapy kill cancer cells? So if you look at the various medicines available today, I think of all, the chemotherapy itself has got a very negative view in the sight of the public. So how does this medicine work in order to kill the cancer cells? I think that is something that we need to understand today. And if you look at the overall division of the cells in the body, the cancer cells are the ones which are very rapidly dividing. So most of the cells in the body stop dividing only when there is damage, then they divide in order to repair the damage. But otherwise, routinely there won't be rapid division of the cells. So the rapid multiplication of cells occurs in a cancer. So the chemotherapy drugs are the ones which usually act on the fast and rapidly dividing cells. So how do they act? They act within most of the drugs act within the nucleus of the cell. So within the nucleus you have the chromosomes, you have the genes. So these are the drugs which act at different levels during the process of cell division. So when the cell division happens, the different drugs act at different phases of the cell division. So during that they arrest the division of the cell. So they cause a blockade to the multiplication of the genes or the chromosomes. That's how the cell division is arrested. So because of that, the further growth of cancer does not happen. So this is how during the various phases of cell division, these drugs will cause arrest of the division by different means of mechanism of action.